Yep. So here's what we have left. We have just a little bit, so I'll do a little demo on making sticky bone. So this is sticky bone right here. So you can, if I can get it to scoop up here. So it pretty much, it sticks to itself, okay? So pretty awesome in that aspect. You don't have granules going everywhere. So we take our liquid PRP, okay, and we're just going to kind of douse it. So this has an anticoagulant in it, so if you wanted to, you could add calcium chloride to it. Calcium chloride is going to start the clotting process, but because the bone does have calcium in it, it's going to start the clotting process. So we'll just kind of move it around there for, add a little bit. It'll take it just a little bit longer. If you're using a tube that doesn't have an anticoagulant, it will take longer for this process, or take less time for this process to start, but because it's got the anticoagulant in it, it takes it just a smidge of time there, and we may not even get it to set up today. Usually it takes about just a couple minutes. You just got to be a little bit patient on it. What I have found is using the yellow tops without the anticoagulant, when making sticky bone, it does seem to become a little more solid, but I just haven't been using them lately because I would rather stick the patient one time if I have that ability. So you can see it starting to kind of set up and gel just a little bit. Kind of saw that break apart there, but that's okay. When you pack it into a socket, you can just place some of the liquid there over it. So still not wanting to set up quite, but as it sits there, it will continue to set up. That's what I was saying about having the anticoagulant in it, the citrate in it. It just seems to take it a little bit longer. This also works a little bit better in the mouth because you do have soft tissue and bone of the patient that's going to cause this to set up as well. So I'll just kind of let that sit there, but you get the whole idea of it, making sticky bone by making cutting up a membrane, making sticky bone, and then coming back and making sticky bone right there. Okay, so it's starting to set up a little bit better, but not quite like we like it, but it'll do for demo purposes. Okay, thank you.